Welcome to the YouTube video. I'm Andrea Maier, the host of the webinar. A little warning, the presentation includes images where the skin is being injected. Some might find this disturbing. Enjoy the show.
I'm feeling like sunshine, like springtime, like something's in the water and I'm taking a deep dive. I'm feeling so weightless, like I'm gonna make it, and nothing in the universe can take this. I can see it clearly now, nothing gonna bring me down. I got my head held high, I'm on my way, and I'm following the signs to my happy place. I'm walking in the light of a brand new day, and I'm right where I belong in my happy place. I got my head held high, I'm on my way, and I'm following the signs to my happy place. I'm walking in the light of a brand new day, and I'm right where I belong in my happy place. And I'm right where I belong in my happy place. And I'm right where I belong in my happy place.
Welcome to the National University of Singapore Yong Loo Lin School of Medicine Healthy Longevity webinar. Thank you for joining us today. The skin is the largest organ. Our wrinkles really tell a beautiful story of our past history. And today we will talk about the interference between aesthetic medicine and healthy longevity medicine. Dr. Jani van Loghem is joining the show. It will trigger, I think, lots of questions. Please use the Q&A function to send your comments, questions, whatever is on your mind. We are starting with a short presentation by Shamin Tien, our PhD student at the Healthy Longevity Translational Research Program. She will talk about taurine. The floor is yours.
Thanks for the introduction. As mentioned, I'm Shamin and a graduate student at the lab. So today I'll be sharing an interesting paper I read in the Journal of Science by Parminder Singh et al. About taurine deficiency being a driver of aging. So let me take you and briefly introduce to you what taurine is. So taurine is an amino acid and you can find it easily in your diet. So in early life, when you have too low levels of taurine, problems in your organs can actually occur. Some studies have also shown that taurine levels in different organs do decrease as you age, but no one has actually extensively studied the role of this amino acid on aging. So this study wanted to just answer two very simple but major questions. First of all, does taurine deficiency drive aging? And secondly, does taking taurine actually help to improve health and life? So the authors actually first took an extensive look at how taurine levels changed, firstly in mice, then in monkeys, and then later in humans. And what they found was really interesting. So basically in all older animals, these older animals had much lower levels of taurine compared to their younger counterparts. So amazingly, when they gave taurine to mice at middle age, they could actually extend the lifespan of these mice by up to 18 to 25%, which is actually a huge number. So taurine was not only effective at extending the lifespan of these mice, but it actually seemed to improve their health as well. So after taurine supplementation, many tissues actually showed tremendous improvements. So this is just a quick snapshot, but this slide actually shows the results to give you an idea of what improved. So mice that were treated with taurine actually showed lower body weight and fat. They had increased bone mass and better bone quality. And taurine even appeared to cure the osteoporosis and weight gain associated with menopause in these mice. So these mice also showed less depression-like behavior. They had better memory and seemed to be less anxious as well. So I didn't show this here, but the authors even tried this on older monkeys, and taurine also seemed to significantly improve their health, similar to the mice. So while taurine yielded great results in animals, what about humans, right? So using a large study involving almost 12,000 subjects, the authors actually found that higher circulating levels of taurine was associated with a lower body mass index and less abdominal obesity. And actually, people with very high taurine levels seem to have a lower chance of chronic diseases such as type 2 diabetes as well. So simply put, higher taurine is actually associated with better health parameters in humans. So taken together, this actually shows and sheds new light on taurine, showing how it decreases as we age, and its exciting new potential to maybe reverse the health decline we often see as we age. So could taurine really be a new anti-aging intervention? If this piqued your interest and you would like to find out more about this taurine study, do check out the paper for more details. Thank you.
Thank you so much, Jamin. I think it's a wonder pill, but let's first wait before we are taking all taurine. Let's wait for the human studies and watch that space. We will also be involved in that. Okay, over to the skin. I'm very, very happy that Dr. Jani van Loghem is today with us. He obtained his PhD on optimizing patient safety during facial filler injections. And as a board member of the Dutch Society of Aesthetic Medicine, he was co-responsible to establish a new medical specialty, which is called aesthetic medicine in the Netherlands, making it the first country in the world having this specialty being accepted. Based on the insights in medical education, he created the UMA Academy, where he trains hundreds of physicians per year for aesthetic training, cosmetic dermatology and surgery, and of course also business and leadership coaching. The latest addition to the UMA Academy is a completely new field titled Regenerative Aesthetic, and today he will talk about that. So Jani, it's really a pleasure to having you with us. Thank you so much for joining, and the floor is yours.
Well, the pleasure is all mine, Andrea, and thank you so much for having me on your wonderful webinar. And we were talking a while ago. We were actually in a taxi getting into a very, very in-depth conversation about longevity, and I'm so inspired by what you are doing. So it's a great, great honor to be on your show. And one of the things that was really amazing to realize is that, well, you are coming from internal medicine and I am coming from the field of aesthetic medicine. Our patient population is very much the same. And so I think it would make sense to look at aesthetic medicine as well and where it is going in the direction of longevity. And where you are actually preventing aging or reducing even aging, what we want to do in aesthetics is now not only to look more attractive, to look better, to look healthier, but actually to use specific products that actually make the skin and the tissues also healthier. So I will start sharing my screen. So I'm going to be talking about the future of aesthetic medicine. And therefore, I think it's important to realize that where we're coming from is the field of, let's say, toxins, botulinum toxin, Botox, that has been injected to reduce wrinkles, and also fillers to reduce folds in the face. And in the field of aesthetic medicine, soft tissue fillers are one of the most important things to make a person look younger, look healthier. But what is actually happening underneath the skin? And that's a really important topic that I would like to discuss today. So to introduce myself, my name is Jani van Loghem. I'm an aesthetic physician, KNMG, and I'm very proud to be part of the group of people that have actually been responsible for the creation of an official medical specialty. And it's now between other medical specialties like dermatology, internal medicine. One can choose to become an aesthetic physician. It's not a full specialty yet. It's a 2-year program, but we are working on it. And maybe, and that was so inspiring of being in the taxi with you, Andrea, maybe the longevity part can actually be fused with what we currently have in order to actually create a full medical specialty. So I would like to also mention a few books that I've published recently. One is on soft tissue fillers, calcium hydroxylapatite, and that's actually the product that I've been using a lot since 2005. And so I have a lot of experience with this product, and I would just like to go through a few new developments and a few new discoveries that we have with calcium hydroxylapatite as a filler, but also as a biostimulatory product. And now we realize it's a regenerative product. I've also published books on botulinum toxin and on prevention and management of filler complications. So let's dive into regenerative aesthetics. And it's a relatively new field. So there's so much to discover, and we have so much homework to do, so much research to do. But it's really, really amazing that we are part of this really exciting new field of medicine. And also, I would like to talk a little bit about using Radiesse, which is the brand name of this calcium hydroxylapatite product, as a regenerative product. So my friend, Kate Goldie, she's an amazing, amazing aesthetic physician. I admire her a lot. And she's published this beautiful paper on the evolving field of regenerative aesthetics. And in her paper, she's very, very clear. Sometimes, even complicated material, if somebody manages to explain it in such a clear way, you really understand what we're talking about. And of course, I think most of the audience here is interested in not just longevity, but also the regenerative medicine, right? So regeneration of injured or diseased tissues, of course, regenerative medicine. The field of regenerative aesthetics is a subfield of regenerative medicine because it is not just looking at injured or diseased tissue, but actually sees aging as tissue damage, right? So there's a degenerative process called aging that changes the tissues. And with regenerative aesthetics, we want to bring the tissues back to their more youthful state. And for regenerative aesthetics, to have a product that has actually regenerative properties, what we need, of course, are cells, right? So the cells that can be activated. And in my field, in especially skin and fat, what our target is of our treatments, our cells are, of course, are not necessarily stem cells as depicted over here, but they're more fibroblasts. So the fibroblasts are really the cells that we would like to stimulate and get into a youthful, active state where they produce extracellular matrix like collagen, elastin, proteoglycans, and we want to also make them produce all these proteins, etc. In the right ratios, in the normal ratios, and respond very normally, youthfully to stimuli that normal fibroblasts do. So that's the first pillar of regenerative aesthetics. The second pillar is the biocues. So the signals that those cells need to be activated. And there could be specific signals. There's a lot that has been written about exosomes. And of course, I think most of you know about exosomes because I'm sure, Andrea, that you've also done at least one webinar on exosomes. And a lot has been told about exosomes, and I think most of us will agree that right now there's so much we don't know about exosomes that for real, let's say, safe human application in real clinical application, it's a little bit early. But it's a very, very exciting field that is definitely worth looking at because these exosomes, they contain a lot of signals. There's messenger RNA, there's microRNA, there's peptides and lipids. And they probably play a very key role in also the field of regenerative aesthetics. There's another type of biocue. There can also be a chemical biocue. And therefore, I would like to introduce that product that I was talking about. Full disclaimer, I am also sometimes getting paid by the company because I use their product a lot. And I really like their product. And that's, of course, why the pharmaceutical company likes me to talk about how I use their product. I'm not getting any sponsorship by them actually for today, but It's a very interesting product. I've been using it since 2005, and it consists of two main components. The active ingredient is calcium hydroxylepidide, also referred to as KAHA. And it's 30% of what's inside the syringe. So you see a syringe here, it's got a whitish gel inside. And the white is, of course, because of the calcium. And these are little microspheres. They're about 25 to 45 micrometers in diameter, and they're in a suspension in a CMC gel. And 70% of the gel, of the volume inside the syringe is the gel. Now, how it works is that when you inject this product into the skin, 30% consists of these KAHA microspheres. And 70% consists of this CMC gel. It's a cellulose gel. And so the cellulose gel gets very quickly absorbed and degraded. And in about 3 months, it's completely gone. Now, these microspheres, they stay and they attract and stimulate fibroblasts to produce collagen. And the amount of collagen that is being produced is actually replacing the gel that has been resorbed. And so once you inject it, for example, into the nasolabial fold, then you see an immediate correction of that fold. And it stays corrected while underneath the skin, something changes. So from the gel, the volume changes into the patient's own collagen. So there's an upregulation of collagen production. And of course, that is due to fibroblast activation. Now, over time, these microspheres, they get degraded. Calcium hydroxylepidide is actually a human mineral. It already exists in the human body, in the bone, in the teeth. And so it's a very biocompatible mineral. And it's actually a salt because it essentially consists of calcium and phosphate ions, and they're like mineralized. So after a while, these calcium hydroxylepidide microspheres, they get completely degraded. And so the extra collagen production is also reduced. And finally, you have like nothing left. And so this is a temporary product. It's not a permanent product at all. So this is an electron microscopy image of these calcium hydroxylepidide microspheres and how macrophages are actually not able to endocytose them. So they kind of start to fire acidic molecules in order to degrade, to get the calcium hydroxylepidide split into calcium and phosphate ions. And here you see a partially degraded calcium hydroxylepidide particle. Now, I have been reading a lot on more kind of like your types of paper, Andrea, kind of like very, very deep scientific papers. And I was thinking about what is the real mechanism of action? And of course, the particles themselves can also function as a pillar, but actually they can also function as a slow release of calcium. And so there's a local increase of calcium concentration around these particles because the macrophages are firing these acidic molecules over here. So this is an image that we made here because we want to explain what we think is the real mode of action. So there's acidic molecules that are fired when the microsphere is in proximity to the macrophage, to the particle, because it's too big for endocytosis, and therefore it has to be degraded first. And so when the calcium ions are actually created, they can go to the fibroblast, and the fibroblast has specific channels, specific calcium channels that will allow influx of calcium. And the influx of calcium, that has a very specific reaction within the fibroblast. And it has also, apart from the fibroblast, it can also have an effect on the blood vessels, on the endothelium, responsible for angiogenesis. And we see this in histological studies that, yes, definitely there's an upregulation of fibroblasts, and definitely there's an angiogenesis effect after calcium hydroxylepidide injection. And so what is happening actually is there's a few really interesting things going on when calcium is fluxing into the fibroblast. First of all, there's chemotaxis. So the fibroblast is starting to move into the direction of the higher calcium concentration, which is in the direction, of course, of these microspheres. And then the fibroblasts are also induced for transcription, because as we know, there's collagen production, there's elastin production, there's proteoglycans production, but also mitosis. So there's actually a proliferation effect after calcium upregulation. And lastly, there's evidence that some fibroblasts are being differentiating into myofibroblasts with contractile capacity. So maybe you remember from the wound healing story that, you know, when there's a scar, for example, there's a contraction. So those are myofibroblasts responsible for this. But this is really different from a scar, because a scar is really a repair, and this is more an upregulation of a normal function of a fibroblast. So we're talking about real regenerative effect. And clinically, and this is how it really becomes visible what we do, clinically, we can inject this product with a non-traumatic blunt cannula just underneath the skin. I dilute it normally, and because the original gel is quite a thick gel, so I can have liquefied with mixing it with a little bit of saline. It's off-label use, but it's really an amazing way of using this product, because as you can see in this video, and I know you only get to see a little bit of like a few frames per second, so it's not going to be perfectly visible, but you can see I'm actually introducing the cannula underneath the skin right now. And the platysma, the muscle over there, is very, very close to the skin. It's actually the platysma has connections to the skin. So the subcutaneous fat is very, very thin layer, but I'm actually injecting it in this second anatomical layer, which is a subcutaneous fat at the dermal subdermal junction. And you can see I'm using this cannula to advance it underneath the skin. And when I'm injecting, the product is a retrograde injection. So I inject the product when I'm pulling the cannula back. And I just go over the entire surface of the neck in this case. And of course, you can also do it in the face, but especially for the neck, because there's so little to really make the neck look younger. It's such a huge frustration for so many people that their neck looks so aged. And, you know, sometimes you actually can see that, you know, people do a lot of work on their face, and then you see this old neck, and then you think, yeah, that's kind of visible that you did something, because, you know, there's a discrepancy between the face and the neck. So it's really important to also, in my field, consider the neck for treatment. And I'll just skip to the result. So this is something that is really, for me, this is a really amazing result. And this patient is extremely happy, because you can see here in the submental area where there's a little bit of a laxity of the skin. It's kind of falling down with gravity, it's a loose, and also feeling the skin between your fingers, it's quite thin. But after the treatment, you see how nicely that skin has tightened and how beautifully the neck has rejuvenated. So there's a tightening and also a thickening of the dermis, and the skin just feels and looks much younger. So the third pillar of regenerative aesthetics are scaffolds. And of course, the fibroblasts need something to hold on to, and they need their scaffolds in order to do their work. And you know, for the fibroblasts, of course, there's the collagen network, right, in the extracellular matrix. So the more collagen there is, the more the fibroblasts can be upregulated. But also the calcium hydroxylapatite particles themselves can be scaffolds, because the contact with the fibroblast to the extracellular matrix components is essential for activation of these fibroblasts. Now, these particles are also scaffolds. So what we see in histology is that actually the fibroblasts are really going towards these microspheres, and they're actually surrounding these microspheres, and they're really getting upregulated. So not just because of the calcium that is being produced, but also because they can actually attach to those calcium hydroxylapatite microspheres. So there's a lot of different products on the market, and there's a lot of differences between these products. And it's for us as aesthetic physicians, it's really important to choose the safest one for our patients, right? Because we don't want to have any late inflammatory reactions. We don't want to have granuloma formations, etc. So there's a difference between a biostimulatory product and a regenerative product. And therefore, biostimulation is basically a very broad term where some components of the extracellular matrix may be formed, like collagen. And there's a lot of collagen promoting, stimulating therapies out there. And whereas regeneration, and that is really the repair and restoration of damaged tissue, and where the cells are actually producing the ECM in the normal ratios and the normal quantities. So if something is regenerative, it's definitely biostimulatory, while when something is biostimulatory, it may not be regenerative. Now, this is my general protocol for using calcium hydroxylapatite as a regenerative product. And I haven't found any other commercially available regenerative products that really tick all the boxes. And I'm sure there's going to be other products on the market very soon, because this is really the new field. This is where we're going in aesthetic medicine. So I'm using the full viscosity, full elasticity gel, which is the darker blue here. It's a strong three-dimensional scaffold, and I use it to lift ligaments. Then there's a standard dilution with a little bit of lidocaine, making it a little bit more liquid for folds, etc. And then the diluted version, or the hyperdiluted version, I use it as a soft liquid scaffold that actually only has the regenerative biostimulatory effect and not the filling effect. So just an example, and I'm not going to take very long explaining this, but you can use the full viscosity of this product. So it is, let's say, focal regenerative activation. So yeah, it may look for maybe non-physicians a little bit intimidating to see a cannula disappearing beyond the hairline like this. But for me, it really makes sense to inject in the subgaleal space. So I'm actually injecting on the periosteum, basically on the skull. And I'm using the full viscosity, so the non-diluted product over here, where I'm actually molding the product with my hands, with my fingers, in order to reposition the soft tissue on the skull. Maybe you realize that when the aging process occurs, that the skull actually is shrinking, right? The skull becomes smaller. And so I'm just giving back a little bit of lost volume of the skull, of the bone resorption. And with this specific individual, she was mostly interested in having a more open, a more approachable look by lifting the brows. So instead of using botulinum toxin, which is also a great choice for brow lift, I'm using this product over here, so focal biostimulation. So I'm going towards the supraorbital rim, and I inject a few retrograde linear threads. And of course, these are very, very highly advanced techniques, and you shouldn't try them if you don't have proper training, because there's a lot of arteries over here. There's the supraorbital artery down there, and it connects to the arteries inside the orbit. So there is, in this area, potential for blinding your patient. So if you inject a product with a little bit too much of the product that you inject inside an artery, then of course you can devastate somebody's life in a very, very, very intense way. And so that's really important that you know exactly how much you can inject per retrograde linear thread and what kind of cannula you should use. Never to use a sharp needle, always use blunt cannula. But in total, you can really make that brow lift up. So with the molding technique, I'm actually using the knowledge of the anatomy, and there's the superior temporal septum that is located over there, and that can give a very nice brow lift. So you can use this product in many different ways, and I've used it in entire facial rejuvenation. And this is just 2 weeks after the procedure, and you can see she looks beautiful, she looks natural, she looks more open. She already looked beautiful beforehand, but this is only 2 weeks after. Now, on the long term, this is one of my patients who has been with me for 10 years. And so 10 years ago, you see on the left, in 2013, she actually looked older than she does now. So this is an example. It's annual treatment. So because this is a temporary product, this is about a year, a little bit more than a year of results. So she's coming back for a small amount of calcium hydroxylapatite, diluted calcium hydroxylapatite in her cheeks. And it almost looks like we've stopped the clock. It almost actually looked like we reversed the clock a little bit. So those are the long-term results. And I'm quite happy to have gambled on this product, because I had no idea when I started using it that it was such a profoundly regenerative product. And of course, this is just one example of the many new regenerative therapies that we have. There's also now a lot of talk about autologous fat, and in combination with PRP. It's been there for a while, but we're going to see much more about that. This is my book. This is where I have published a lot of injection protocols. It's, of course, a book for physicians, for injectors, anatomically based, especially considering the arteries that can lead to the biggest complications, and how to prevent that from happening. We also give courses like you do, Andrea. So, and UMA Academy, we give the Radius Expert Techniques course, where we just focus on that product, because there's so many things that the pharmaceutical company cannot talk about because it's off-label. But we realize that there's so much to do with their product, that we actually created a course around it, because we just feel that our colleagues need to know how to tweak that product to its maximum potential. So with that, I would like to say knowledge is beautiful, and I'm sure you agree with that, Andrea. And thank you for listening.
Thank you. Thank you so much. I agree with that statement, that knowledge is beautiful. And of course, we will talk about how can we also bring the beauty to the inside of the body. So how can aesthetic medicine really join and interact with the healthy longevity medicine scene we have. But let me ask you first, you are focusing lots on fibroblasts. What about the keratinocytes, the melanocytes, etc.? So many different cell systems within our skin, and the epidermis and the dermis, in the subcutaneous tissue. So why these fibroblasts?
Yeah, I guess because the fibroblasts, of course, are the main cell of the dermis. And of course, the epidermis is also an important part, because that's actually the real surface of the skin. And we actually do see now, and we are just discovering all these things about these products. And actually, yes, there seems to be an improvement in melanocyte. Keratinocytes, I am not 100% sure, but we do see a very nice radiance to the skin. It's a very nice, beautiful, healthy glow that we see. And it's a very typical thing that we see. And that's probably also because the reason that they call it radiesse, because it makes the skin radiate. So does that mean that it has an effect on keratinocytes? I don't know. But I do know that there's an increase in glow, skin glow, and that has to do with the amount of water that's actually inside the epidermis. So you may be right. Maybe there is an increased turnover of the keratinocytes. Yes, and definitely a great idea to investigate.
Yes, I think we will come back to the keratinocytes in a second, what kind of products we should actually expose our skin to. Maybe we can do that in a second. But if you had a beautiful example of that women already 10 years in your practice and really seeming very, very different in terms of their phenotype, really looking much younger. Can you foresee any side effects if you are stimulating this fibroblasts all the time or every year to proliferate and to produce that collagen? Maybe you can also say what kind of collagen they produce. Any idea if you are pushing them into the senescent state and making it more difficult in the end?
Yeah, it's actually a possibility to push them into the senescent state, but based on my clinical experience, I would say that there is no limit. We can keep on stimulating those fibroblasts, and we keep on seeing improvement in how the skin looks, how the skin feels. I did have some patients that are like very enthusiastic about, the effects that it has on their face, and they keep on coming back, and actually they don't wait until the effects are really gone, but they actually build up and they build up and they build up. So after a while, there's so much collagen that is really becoming more difficult for me to get through the tissue with my cannula because there's so much collagen production. I wouldn't call that a side effect. But it is definitely changing the fat a little bit because fat is usually very soft, but with all that collagen production is becoming much more firm and a little bit more stiff. And that's why I don't really use it as a volumizer in the anterior face because it's a very mobile area. Here on the side of the face is not very mobile, so that's not a problem if it becomes a bit more firm. But in the anterior face, I usually use hyaluronic acid, specific, very soft hyaluronic acid, that is actually much more, let's say, respectful to the mimics of the face. So that will give a much more natural result.
Yeah. I can understand. I did my PhD on culturing fibroblasts, and it took me 3 years to culture them into the senescent state. So I think they're a beautiful cell type, but of course it can also then induce fibrosis, etc. So let us go back a little bit to the epidermis and to keratinocytes, etc. I think lots of listeners would also like to learn what kind of products can you use, maybe our first products, and then we are going to the lifestyle to prevent skin aging in the first instance.
Well, if you ask me, of course, we have to start with protection, right? So we have to start, with the SPF. That's the basis of everything. And then I think in combination with calcium hydroxylapatite, also looking at maybe also fibroblast keratinocytes, I think vitamin C is a very, very, very good idea. Then I'm not sure which product I would really advise for activation of keratinocytes, but of course we know that tretinoin, retinol, they have a very, let's say, strong upregulatory potential of the cell turnover, and well, in my opinion, I think we should definitely combine it with some hydration. There's other doctors thinking differently about that, because the more you hydrate the skin, the more you make it lazy. There's Dr. Zaino Bahaji. He's a very famous dermatologist, and he's very, very strongly against moisturizers because he says, well, if you stimulate the skin to create its own moisturization, then it's of course much better than to make the skin lazy. And yeah, I do believe that, but in generally speaking, I would say that hydrating the skin gives an instant, like plump, and which really looks like better. I mean, if it's about the looks, yeah, definitely use hyaluronic acid, but maybe from the inside, you should maybe not. Do you have specific ideas on keratinocyte activation?
It's a question if you need it. So I think it's always the question when you're starting. But coming back, I think your conclusion is now to use the creams with lots of water inside to hydrate the skin or not? Is it just a myth?
I would say no, definitely. I think because if you apply hyaluronic acid serums to the skin just looks great. And of course, we know that there are some glycolic acid, stuff like that, so ferulic acid, that really has also a stimulatory effect on the keratinocytes. Actually, one of the products that I use personally has vitamin C and ferulic acid. It's called CE ferulic. And that's the only skincare I use because I feel it's the only thing that I need.
Okay. Let's go a little bit to products which are already on the market, but I'm not sure what the evidence base behind it is. And you already touched on that, exosomes. So very often exosomes are even being given topical or even with microneedling, etc. And I think the entire idea is if you get exosomes out of stem cells, out of the supernatant from what they make, this will make not only the skin younger, but maybe the entire body younger. We have heard of stem cell transplantations, etc. And I think a product out of that is the exosome treatment. Can you tell a little bit where it stands from an evidence-based level, if microneedling exosomes on hair or on skin, etc. is useful or not?
Yeah, it's of course it's a new field, so the evidence is quite limited. However, what's really important to consider is the source of the exosomes. So I think most, for me, the most powerful regenerative exosomes are actually from human origin, and then actually from embryonic origin. So placenta-derived or amniotic fluid-derived stem cells that can be cultured, and the exosomes that are coming from those stem cells, because you can imagine that those stem cells are actually responsible for the creation of a new human, right? So they have really potentially an amazing regenerative potential, and that's the idea behind embryonic exosomes, and I believe that, and compared to the other exosomes on the market, I don't really have a very clear overview of all the different products, because there are so many different sources that have been used. So for me, it feels and it is, again, it's not evidence, but to my gut feeling, it is definitely the exosomes from the embryos that have the most potential. Now, where is the evidence of how clinically the skin improves is basically case reports. So I'm talking to Professor Andrea Maier. So that means that I could not use the word evidence when you talk about case report, right? But
it's
still,
not that bad.
It is published, and there's some really great papers on exosome with microneedling, also especially for androgenic alopecia. It seems to work very well. It seems to work actually much better even than PRP, which has been the standard for androgenic alopecia clinical treatments.
Yeah, no, I fully agree with you. So first of all, I think we have to really see what these exosomes are, what's in the parcels, etc., what's being secreted, what does that skin or the hair or the entire body need. But I think most importantly, yes, let's test it, as you also do. I know you do lots of research and lots of, you're really publishing very well and publishing books, etc., and really bringing the evidence out. I think we should also do that for the exosome treatment. But that it makes sense that there's a theory behind this, I fully agree with you. Let's talk a little bit before going to Xiaoping. Let's talk about gravity. You really nicely showed that gravity is the source that everything is hanging in the end, not making us as beautiful as we were. We have more skin than just our neck and in our face. So what do we do with the rest? And how could healthy longevity medicine help there to maybe prevent the gravity problem in the end? Any ideas?
Well, yeah. Okay. So if my objective would be to become very rich, then I would say, come to me and I will treat your entire skin with some biostimulatory products. However, in the interest of my patients, I think it would be wiser to send them to you, where you give them a treatment where the skin is being improved from the inside. And I think there's a lot of evidence. There's hormones, hormone replacement therapy. There's DHEA. You know much more about this than I do. But so what I could do is just like specific areas of interest, I would say specific areas of frustration. It's actually mostly what we're talking about. For example, décolletage wrinkles, or like inner upper arm laxity. Specific wrinkles on, different like abdominal laxity after pregnancy. So these areas, if it's like a focused area, then yes, definitely I can do something with the product like calcium hydroxylepidide. There's other biostimulatory products that can also improve the laxity state of the skin. But I guess, Andrea, I think we have to collaborate on that, because you can probably like make the results of my treatments even better if the skin is also being stimulated from the inside, because we are very dependent on the fibroblasts. And if you can bring them to an optimum state, then the extra activation that I can give them with my clinical treatments can actually make the results much better.
Absolutely. We have to talk further. Maybe the second time in a taxi was a very nice taxi drive to the airport. But you're right, because the skin is attached to lots of other organ system. It needs the vascularization, etc. So it really needs that nutrition, which is most healthy, also for the fibroblasts to stimulate their production. Okay, I have lots of questions for you, but also our audience have lots of questions. So over to Shuping, our research fellow at our group. So Shuping, tell us, what does the audience want to know?
Thank you so much, Prof Andrea, and thank you so much, Dr. Loghem. I am, for one, very excited for your presentation today, and there's lots of questions. Okay, can I ask you some hardcore science questions? Okay, the audience is asking, how do macrophages break down the calcium hydroxypeptide? And does this process alter the pH, given that most calcium compounds are generally insoluble unless the pH is lower to an acidic level? Yeah.
Mm-hmm. Yeah, the evidence on this, we don't have it yet. I'm actually working on it right now. I'm doing the study now myself. It's actually a lab study where I measure the amount of calcium that is being formed with specific pH levels, and so to measure the degradation speed, basically based on the acidic environment. So we don't have any results on that yet, but we do know that there's in the macrophage. So there's a foreign material in the tissue. Okay, so there's something that is not supposed to be there. So the macrophage is the big cleaning cell, right? So it wants to clean up and remove the particle that shouldn't be in the tissue. And so when it wants to phagocytose the calcium hydroxylepidide particle, it turns out that the particle is too big for phagocytosis, for endocytosis. So in order to degrade it, what usually happens with the larger particles, that you can get multinucleated, let's say, fusion of macrophages to form multinucleated giant cells. This is a physiologic effect. It's normal. For example, when you have like a splinter or something, that's also what you can see. In the end, where am I going? The question was
lowering the pH to an acidic level is not right. So based on
so this is also something that we normally see when the macrophages want to degrade something that is too big. Then they have a specific ATP pump that fires basically lowers the pH by firing the H+ towards the particle. And so there's an acidic environment, and because of the lower pH, it's a salt. Then so the salt actually gets into solution.
I see. So somehow it's triggering some sort of immune reaction, right? So, well, that's okay. And another question is what distinguishes calcium hydroxypeptide from regular calcium supplementation? Like we can take calcium in our diet, right? What is the difference?
Yeah, I think the big difference is that when you inject calcium hydroxylapatite, you have a very local, let's say, source of a slow release of calcium. So around these particles, because they start to dissolve, then you have this calcium into solution that is around these particles. So there's a very local focal increase of calcium. And that has the local effect. And of course, these concentrations may be higher than the concentrations that you would get after like oral supplementation of calcium.
Oh, I see. So there's another question which I don't really understand, but maybe you can try to understand it. The duration of effectiveness for injection appear to be shorter in individuals who engage in regular exercise. Do you have any recommendation for injection that have a longer lasting effect in active individual? Do you see that?
I'm not aware of that study where it shows that very active people have a shorter duration of effect in fillers. I do know that people that do a lot of like muscular like very strong exercise, they have a shorter duration of botulinum neurotoxin effect. And because their muscles are just more used to recuperate after like micro trauma. And so basically with toxin is you're also creating some kind of muscular trauma, a temporary trauma, and then the muscle has to recuperate from that. And so we've seen definitely that in sports, people that are very active, that they have a shorter duration of botulinum neurotoxin, but with fillers and especially with a biostimulatory product like calcium hydroxylapatite, I don't think there's a reduction in longevity and duration of effect.
I see. So regarding the toxin, we know that it temporarily causes the muscle paralysis and then the wrinkle is gone, right? So is it possible to combine calcium hydroxypeptide with the botulinum toxin?
So this is what we do on a daily basis. Yeah, so definitely. So and of course we don't really mix it into one syringe, in that way we don't combine it. But in the same treatment, we would focus on different types of age-related anatomical changes, right? So we know where the anatomy changes in the most specific, significant way, right? So, for example, there's bone resorption, right? The orbits become wider. And so when the orbits become wider, especially here in the infralateral side, there's this little depression that people get. So this little depression is called the palpebromalar groove, and it's evidence of aging. So if you look at somebody and you see this little hollow, it automatically makes you see the person has aged. So what we do is we try to hide the evidence of aging. So we put a little bit of product over here, but also there is the orbicularis oculi muscle, right? The sphincter muscle that creates the crow's feet. So in combination with what we do with a little bit of volume that we replace here to correct the bone resorption, we also inject some botulinum neurotoxin in order to relax that sphincter muscle. So these crow's feet, these wrinkles also become less visible.
Oh, I see.
So it's always a combination of different products that we use in one treatment.
Oh, that's very interesting. And can I ask another question? Is it had to be injected subcutaneously to the subcutaneous fat, right? What is the interaction with the adipocyte in this context? Does it have any interaction with the fat cells?
We don't think so, but it's definitely it is interacting with the fibroblasts. But to my knowledge, it is not interacting with the fat, but just with the fibroblasts that are actually there in the subcutaneous fat. There's actually more fibroblasts than adipocytes.
Oh,
but the adipocytes are just bigger. But there's just in number, there's more fibroblasts. So the fibroblast is really the target of calcium hydroxylapatite. Yeah.
oh, I see.
And actually, we're not only injecting it in the subcutaneous fat, but also in the deep fat and in even all the way on the bone.
Oh, that must hurt. Well,
No, it's painful. The skin is painful. So to get through the skin is the painful part, but we give a little bit of local anesthesia. And so basically for the patients, it's a very doable procedure.
oh, okay. It looks scary to me. But anyway, is there anything effective for addressing the age spot on the skin? Like, yeah, the audience is asking.
Well, not with fillers, not with toxins, but definitely with other modalities. So of course, we also have lasers, we have chemical peels. There's microneedling, maybe even exosomes that can be microneedled into the skin, and that let's try it. Of course, the topical bleaching agents, etc. Even glutathione, I think, has an effect on pigmentation. Actually, it brings me back to Andrea's mention on the exosomes, which is somehow really interesting. So if you microneedle these exosomes into the skin, of course, there's going to be some of them in the system, right? So some of them get into the circulation, and they could also potentially have an effect beyond the skin, and that's what actually could make it really interesting.
Well, we are very, very thank you for all your questions, all your answer here. And I think that's all from the audience. Back to Prof. Andrea.
Thank you so much. So what I learned is gravity is an issue. And we have to keep our fibroblasts as our good friends and healthy to look nice. So thank you so much, Jani, to be at our show. You as an audience, please leave your comments in the chapter function. And I would like to announce 2 events. Pencil in your agenda in February, 2 events. The first one is the Unlock Healthy Longevity Supplement Conference from the 29th of February to the 1st of March 2024. Our global conference focuses solely on the role of supplements, and I can tell you Singapore will be the epicenter of leading scientists, clinicians, industry partners, and consumer representatives to explore the power of supplements to optimize health, and I think also to optimize the skin. And then the same week, the NUS Academy for Healthy Longevity invites you to join the 3-day course, the intensive course, to really explore why we age and really learn from the best. All the information is being given in the chat box. The next episode will be on the 4th of January 2024. Professor Brian Kennedy will host Professor Richard Farringer. He is Professor of Biogerontology at the University of Brighton in the UK. It will be lovely, as always. I will leave you with a video. Just listen to this 74-year-olds. Have a very good Christmas and a new day, not a new day, a new year, and take care.
How old are you?
74.
What does it feel like to be 74?
Feels like 30.
As you go through life, what does it feel like to gradually become an older person?
Well, the answer to that really will vary from person to person depending on their health. I've been very lucky. I haven't had any health problems.
How have you stayed in such good shape?
I cycle, I walk a lot, eat well, no processed foods, or as little as possible.
If you could go back in time and relive any age that you've been, is there one in particular you choose?
30 to 40. That's when I got married. I traveled a lot. My wife and I had our children. We had a nice home. I had a good job. It was good.
So what's the biggest life lesson that you continue to teach your children?
To have a sense of humor, not to take things too seriously.
What is something that we tend to prioritize a lot when we're younger, but then as we get older we realize actually isn't that important?
Material wealth, like the new car, the big house, the fancy clothes, those things come and go.
What's important instead?
Well, what's important is really it's your health. If you don't have a good health, you're not going to enjoy life.
I'm feeling like sunshine, like springtime, like something's in the water and I'm taking a deep dive. I'm feeling so weightless, like I'm gonna make it, and nothing in the universe can take this. I can see it clearly now, nothing gonna bring me down.